Welcome to the DHSS webinar around COVID's impact on people with disabilities in Delaware. I'm Cory Nourie, and I'll be the moderator for today's session. I'm the Director of Community Services for the Division of Developmental Disability Services, and today we are joined by two guest panelists, Emmanuel Jenkins, who is a self-advocate and administrative specialist at Delaware's Developmental Disabilities Council, and Gary Cassedy, who is Vice President of Programs, IDS, and Recreation and Respite from Easterseals, Delaware, and Maryland's Eastern Shore. So thank you, gentlemen, both for joining us today.
Thank you.
In starting today's session, I'm going to give a little bit of an overview regarding DDDS's perspective regarding COVID-19. Obviously, this is a scary time for people, an anxiety-producing time for individuals with disabilities and their families. And from the division, we are working with providers on a regular basis, many times a day actually, to make sure that we are supporting people as best as possible to be as healthy and safe as possible in what is very trying times. Additionally, we are working with our providers to make sure that they have access to PPE, the protective equipment necessary to support individuals who are COVID positive. And our providers, I'm happy to say, have been working for months, actually, before COVID actually hit, to prepare for this. And so providers have access to the resources they need to make sure that they are protecting people and helping everyone maintain their safety as much as possible. The reality is that there are people who have been tested positive for COVID-19 within the division as far as service recipients and also people who are providing direct support. And so when that happens, we have a process in place to notify people who have been impacted, both fellow people who live with other housemates, but also guardians, as well as other direct support professionals. And so, as I mentioned earlier, we're having a lot of communication on a regular basis to make sure that we are doing everything we can to keep people connected and as healthy and safe as possible regarding COVID-19. For those folks who are living at home with their families, the Columbus organization is continuing to do their outreach through their community navigators to make sure that people have access to what they need to maintain their health and safety. So some of our community navigators have been helping families with securing food, with securing other resources that are necessary, coming up with ideas for entertainment and helping people stay connected and also contained because of social distancing and the social isolation that we're trying to have in place to flatten the curve under the governor's orders. So people are being really creative and coming up with strategies to try to keep people engaged as much as possible using technology. So we have a lot of people who are utilizing FaceTime or Skype or Zoom or Google Hangouts to be able to communicate with loved ones who are maybe distant from them, or even to keep in touch with program participants and their friends, where otherwise, we would all like to be out in the community and doing things and connecting, and knowing that that's not possible right now. We're really trying to encourage the use of technology to make sure that everybody stays connected as much as possible. From the division's perspective regarding employees, everyone is still working, so that's great. We are all essential. What you'll notice is that most people are working from a different location, so you get to see different backdrops in people's homes when you're doing a video call as opposed to their office or the conference room, but everyone is still working. So if anyone in the community who's watching this has a question regarding DDDS services, at the end or in the comments, there will be contact information. You can absolutely get in touch with someone from DDDS, and we will make sure that someone responds to you. Even with a generic question, if you reach out to us, we will have someone follow up with you, because we are really all in this together, and we're trying to make sure that everyone has access to the communication that they need to make sure that we are all doing everything we can to flatten the curve and eventually get back to whatever our new normal will be after COVID-19. As a state employee, as a relatively new state employee, I can say that I'm really humbled by this experience and the way that people have come together, both from the DDDS perspective and the department perspective, but also from the provider community. And so I've been really impressed by everybody taking this very seriously and making sure that we are doing everything we can to move things along in a positive manner to hopefully get us back to that new normal as soon as possible. So now I'm actually going to hand it over to Emmanuel Jenkins, who's going to do a little introduction and talk about his perspective from the DD Council and as a self-advocate. Emmanuel?
Thank you, Cory. So when it comes to COVID-19, the council, the Delaware Developmental Disabilities Council, has been receiving phone calls, of course, from the community looking for services. This is a new experience for everybody. So no matter how much work we did prior, this was something we wasn't looking for. So as a council, we try to help people navigate to services because the council is not a service provider, but we are very fortunate to have tons of resources and have some wonderful partners, such as DDDS, and being able to come together at a time such as this. We, as a council, receive phone calls such as people looking for medication, food, those are central items like hand sanitizer. Everybody needs hand sanitizer, toilet paper, those kinds of things. So for me, I'm in a very unique position. Not only do I understand it from a advocacy standpoint, but I am a person with a disability. So prior to COVID-19, I have been tasked within my office to not only do the administrative things, but to build community engagement. So all those phone calls I was already getting prior to all of this because I am a guru of when it comes to finding things for individuals. So what we have seen on the ground is people really trying to figure out what's next. This pandemic, was not planned. So how can we, be safe and figure out how to still get the services we need? Even when we talk about Easterseals, who I'm a big fan of, Easterseals is one of the ways I'm able to live independently and have a family and go to work and go to school. But for the pandemic, being an individual that hires his own attendants, you know, when people realize, social distances and the risk, that it took, I'm very fortunate to have my wife and my mom, but there are so many people who rely on complete strangers to come and get them out of bed or to come and prep their meals or come and even have a social hour. So some of the phone calls we've been getting, how am I supposed to get my medication, or how am I supposed to receive my mom's meals that are at the door because they can drop them off, but they can't come in. So, how do we deal with that? So we're constantly looking and researching. Our director is on the emergency calls, as a director. So we kind of hear what's going on and try to adapt quickly because, as I said, this is something that was not planned. So not only when we talk about individuals living on their own, but even for individuals that live in group homes and nursing homes, how do you really keep social distancing when someone needs hands-on services? Cory, you talked about it earlier with the protective equipment. How do we get that in the hands of individuals who need it? So we as a council been really looking at ways to make an impact now and not 9 months after this is over. This is a response time. We need to respond now, and we've been very fortunate, and I'm glad to say when people call our office and I listen to their stories and their struggles, and by the time they get to me, they're already frustrated. But it's such a relief to tell them that I really understand and really do mean it, And when I go into a little bit of my story, they kind of relax a little bit because now they know the person on the other end of the phone, really understands. So we have been, a lot of our council members who are individuals with disabilities have been, advocating not only for for themselves, but for other people. I know myself personally, I like to call myself an advocate because I speak for everybody, regardless if you have a disability or not. But I agree. I think where we are as a state, we have really came together. This is unfortunate times, but this is also our opportunity to come together as a whole.
That's great, Emmanuel. Thank you. And that's a great segue into Gary Cassedy from Easterseals. So Gary, you want to tell us about your perspective from Easterseals?
Sure. Thanks for having me. As you know, Easterseals is one of the larger and most diverse providers of disability services in the state of Delaware. We also cover part of the eastern shore of Maryland. During this time, some of our more visible services have been suspended, at least partially, while others of our services continue without any ill effect. Notably, personal attendant services, such as Emmanuel participates in and mentioned, and our therapy services, which are primarily early childhood, have been able to convert to telemedicine. So luckily, those supports for a lot of families with pre-diagnosis, developmental delays, et cetera, those services are continuing through this, what otherwise would be a disruption. Our day programs for people with intellectual disabilities and a separate program for adults with other disabilities have both been suspended, as you can imagine, because of safety concerns under public health guidelines. Our staff continue to make contact with those participants and their families just to, like Emmanuel mentioned, basically stay in touch and try to keep a handle on what people's needs are. More than half of the people we serve in our day programs are supported by the Columbus organization, as Cory mentioned, and the Columbus navigators are the primary contact for outreach for those families. So I'd encourage those families to go to your community navigator under the Columbus organization. At the same time, however, Easterseals continues to operate our community outreach program, where we have a couple case managers who are resource available folks for information and referral for anyone in the community on disability issues. So just like Emmanuel does, people can call the phone numbers that will be provided later, and regardless of who the service provider might be, our caseworkers can find people to the right solution to meet their needs.
That's great. Thanks, Gary. So we've actually had some questions come in before today's session started. And so I'm going to read some of the questions out loud, and then I'll hand them off to Emmanuel or Gary, or you guys feel free to jump in too. So Emmanuel, I'll start with you. Someone said, as someone who uses a wheelchair, I now spend less time in the community because of my underlying chronic health conditions. Can you talk about some ways I can socialize and stay connected without leaving my home?
That's a very great question. And to whoever asked that question, thank you for your question. What we have found, and I kind of touched on it earlier, this is a very unique time. I know for years we, as a council and state council and some other agencies or providers have been advocating for the ability to meet over Zoom and to not have to worry about quorum. One of the things we have done as a council, of course, everybody's virtually right now, so we moved everything to virtual meetings. So even though COVID-19 happened, now we are more accessible to those that can't leave their home. So we are actually encouraging individuals to to connect virtually through Zoom or GoToMeeting or just to find a way to connect, even if it's through social media. Um, in my personal life, my wife just had a birthday, so we had a virtual birthday party, and that's not typically heard of, but really trying to find a way to connect because we all know mental health is very important, and being isolated for months at a time can really play an impact on mental health. So we really encourage individuals to connect virtually, even if it's through social media, even if it's through Messenger, but keeping that human connection with a fellow family member or a community member.
Thanks, Emmanuel. Gary, someone asked about being an employee who has a disability or an underlying condition and being asked by their employer to come back to work, even though their doctors consider them to be a vulnerable person. And they're asking, what do you think we could do, or how should they handle this? Do you have any ideas?
I think this is a question that will present with a number of people, and the answer is not terribly clear. We've been doing some exploration with the legal community as well as disability communities. And I think generally the thinking is that if somebody has a bona fide medical reason such that they should not be returning to their workplace, they probably have a valid sort of road to travel under ADA considerations. We have little experience with the current parameters, but my suggestion would be that that individual get a certificate or a note from their doctor indicating that they're at particular risk under the circumstances. And I think most employers would be very sympathetic to that.
Right, I agree.
And I know we all need our jobs. We all need our jobs, and it's important to the economy and then being able to provide for your family. But I think the first and foremost thing is your health. So, as Gary alluded to, the Americans with Disabilities Act, and really, of course, there's nothing set in stone because this was not planned. But, reaching out to the Mid-Atlantic ADA Center to ask those particular questions. Am I covered under the Americans with Disabilities Act? Because it doesn't have to scream disability, for people to research and to get clarification. Am I protected under this Americans with Disabilities? Because it really comes down to if you don't take care of your health, then you can't go back to work and you can't provide. And that employer, I agree with Gary. Hopefully they would be sympathetic, but if it came down to your health, that employer can, when we go back to our normal, they're going to just be looking for another employer. It really comes down to the individual's health.
Right. I think under the circumstances, we also need to be aware of the potential dangers for the situation being misconstrued such that some employers may think that they have a more general obligation to exclude people from disabilities from the workplace.
Right.
I think it's a double-edged sword. I will point out that as an example, we have quite a few individuals from our intellectual disabilities program who continue to work in essential functions, essential businesses in the community today.
Which I think is a wonderful thing and really demonstrates, again, how important people with disabilities contributions are to society, where sometimes as a whole, there's a devaluing going on. So I think one of the upsides of COVID, if we can frame it that way, is that we really have highlighted the essential work that individuals with disabilities do in our community. So that's the upside of it. One of the questions that we're hearing coming across from a couple of different avenues actually is regarding if somebody needs to go into the hospital and they have, if they need to be hospitalized because they are COVID positive, and they have an intellectual developmental disability, they don't use words to communicate, and there are hospital restrictions in place as far as visitors, what can be done. And so one of the things I just want to highlight is that there's a lot of advocacy going on right now addressing this issue around the country. And in Delaware, one of the things I would like to just highlight is to think about strategies for emergency planning even beyond COVID-19. And one of the things I try to recommend a lot is for individuals who don't use words to communicate or who communicate differently, for anybody who knows that person and interacts with them on a daily basis, is to think about ways that if you weren't there as a caregiver, other people would be able to interact with that individual and support them. And so with technology, with cell phones, you can make videos of someone's facial expressions or the sounds they make and what they mean. And that way that could go with somebody on a private YouTube channel. Additionally, if someone has certain expressions they make, maybe think about taking a picture and having it be kind of a cheat sheet that says, this is the face that Cory makes when she's upset. And that way that just goes with the individual, so that if a new caregiver has to jump in, whether it's in a hospital setting or it's a neighbor, if someone gets sick, they'll have some entree into how the individual communicates. But the issue about lack of hospital visitors right now is something that we are working on across the state, and several advocates are working on. And I can say for the individuals who are part of DDDS who have been hospitalized, I've heard really good communication from the healthcare system and back to the provider community and to the direct support professionals. People are utilizing technology like Skype and cell phones and video conferencing and those sorts of things as well for the communication. But it's definitely something that people are nervous about. And so I just try to think about what you could do proactively in case you get into that situation for someone. Gary or Emmanuel, have any comments?
Cory, I'd like to sort of give a shout out to the residential providers. As you know, they're extremely stretched under the circumstances where they used to rely on day services for the daytime activities of pretty much all their residents for Monday through Friday. And now they've got 24/7 coverage needs on top of the workforce issues of people falling ill, et cetera, or not otherwise being available. So as you know, one of the great features going along with those residential services is if one of those residents becomes hospitalized, I'm sure there are available caregivers who would volunteer to provide supports in the hospital. So I hope DDDS and Health and Social Services can facilitate the acute care settings being more accommodating in terms of people with intellectual disabilities or other disabilities which make communications more challenging.
Definitely. And Gary, that was a nice little lob to me for that. So regarding the lifespan waiver, the Appendix K amendment, we did get approval to allow for a DSP to go into a healthcare setting, whether it's a nursing home or a long-term care facility or a hospital, to provide direct support for an individual with COVID who, because of communication needs or personal care needs or behavioral needs, the facility may not be able to best meet their needs based on the current staffing. And so we do have that authority under the Appendix K amendment to allow for that to happen, which is a great feature. So we're actually running out of time, which is so hard to believe, but it's easy when you're having fun with conversations here. One of the other questions that we're getting a lot about is kind of around services in the state and evaluations and assessments and things that were now kind of put on hold. And so I just want to encourage individuals, if you have questions regarding the status of something, is to reach out to that department that you're working with, because everybody from the state perspective is still working, and a lot of authority has been granted to allow people to provide assessments and evaluations through teleconferencing and video conferencing. So I just want to encourage you to check back into with that division or department to find out what the next step is for you in that process. As we wrap up today, we're going to have additional comments in the questions in the comments sections for people we didn't get to address their questions today. But I want to encourage people to call Delaware's 211 for medical or social services needs. And you can also call 711 for people who are deaf or hard of hearing. And I also want to acknowledge Pamela, our ASL interpreter. Thank you for your support today. And then additionally, the go-to resource regarding coronavirus is de.gov/coronavirus for updates regarding Delaware. Thank you, everyone, and please continue to be well. And make sure you wear your mask under the new order from the governor, wash your hands, and we will all get through this together. Thank you to Emmanuel and Gavin and Gary for participating.
Thank you.